OSHA considers back injuries to be the #1 workplace safety problem. In fact, studies show that back injuries are the leading cause of lost time injuries and workers' compensation claims. Back injuries can be very painful and expensive to diagnose and treat. Once you've had a back injury, the effects can often last for months, years, or in some cases, the rest of your life. The purpose of this training program is to provide you with knowledge about the back and how to keep it healthy. The items we will discuss are the structure of the back, causes of back pain, proper lifting and carrying, equipment for lifting and moving, back safety guidelines, and maintaining a healthy back. After watching this training program, we hope you will not only understand how to prevent an injury to your back, but also the proper procedures to maintain a safe and healthy back. The back is a complex and intricate system made up of many components. The primary components are the spine, spinal cord, and muscles. Most back problems are related to the spine. The spine is the part of the back which supports the trunk and head and is paramount in walking, running, sitting, standing, and more. The spine houses and protects the spinal cord, as well as giving flexibility to the body. The spine is made up of many small bones called vertebrae and has a natural S shape. The vertebrae are connected together by spinal discs, which act as shock absorbers to cushion and separate the vertebrae. The spinal cord, inside the spine, is the central nervous system for the entire body and is composed of millions of nerves. There are approximately 400 muscles which help stabilize the spine and help with proper posture. More than 1,000 tendons connect these muscles to the spine. Back pain can be debilitating. Many injuries to the back occur because of years of neglect and misuse. Improper lifting and carrying techniques, poor posture, lack of exercise, a poor diet, and excess weight can all expedite this deterioration. Some common back injuries include strains, sprains, and herniated discs. Once the back becomes weak, any sudden movement or improper lifting technique can cause an injury. Typically, you will experience pain whenever you strain, sprain, or in some way injure the back. Back pain can last a few days or even several years. There are several causes which can lead to a weakened back or back injury. Among the causes are physical condition, posture, tension and stress, accidents or trauma, and musculoskeletal disorders. Let's examine these causes more closely. Physical condition is the key to a healthy body and back. As we age, the back generally deteriorates, and your overall physical condition plays an important role in the aging process. Over time, the back muscles tend to lose strength, and spinal discs can tear, rip, or become herniated. Lack of exercise, a poor diet, and excess weight can all expedite this deterioration. An unhealthy diet can lead to health problems and excessive weight. Extra weight means more strain on the back, and a lack of exercise leads to a weak back. This is a recipe for back pain. Good posture is important for back health. As a child, your mother probably told you not to slump over and stand up straight. She was encouraging you to have good posture. The spine functions better when its S shape is maintained. Sitting, standing, or lying down incorrectly for long periods of time can affect the back negatively and cause muscle fatigue and back pain. We all live stressful lives. Muscle tension can be brought about by stress and anxiety. Tight muscles can cause muscle spasms and back pain. Relaxation can help relieve muscle tension. Being in an accident can cause serious back pain, whether you slip, trip, fall, get struck by machinery or equipment, bend in an awkward position, or are involved in an auto accident. Musculoskeletal disorders can be caused by repetitive motions, awkward work positions, and static work positions. These types of injuries refer to injury or damage of skeletal muscle, tendons, bones, ligaments, joints, nerves, blood vessels, or related soft tissue, including strain, sprain, and inflammation. To minimize the possibility of a back injury, you need to practice safe and correct lifting techniques. Here are some guidelines for lifting and carrying safely. Plan ahead. Before lifting an object, know where it will be placed. Make sure the path is clear of any obstacles. This will help prevent any awkward movements while carrying the load. Be sure to prop doors open or have someone there to keep them open if necessary. Never try and open a door while carrying a load. Take the safest route and avoid slippery and uneven areas. If lifting with another person, agree on the plan and route before you start. Check the weight. Before you lift or carry an object, check its weight. Pick up a corner or push the object lightly. If the object is too heavy, get help or use a mechanical device. Do not try to lift objects that are too heavy to handle. Get help with bulky or awkward objects and with objects which block your line of sight. Never lift anything unless you are sure you can do it safely. Lifting the load. Stand close to the object with your feet shoulder width apart. This provides a solid base for lifting. If your feet are too close together, good balance is difficult to achieve. Too far apart, and movement will naturally be reduced. Keep your back straight and bend at the knees. Never use your back to lift. Focus on keeping your spine straight, thereby shifting most of the weight off your back and onto your legs. Keep your eyes up and look straight ahead. This will help keep your back straight. Tighten your abdominal muscles. Doing so will help your back stay in a good lifting position and help keep you from straining your back. Remember, lift with your legs, not with your back. The leg muscles are much stronger than the back. Lift straight up, moving slowly, and keep it close to your body. This keeps your body stabilized while lifting. When the load is too far from your body, additional stress is placed on your back. When turning, move your feet. Never twist or turn your back when lifting or carrying a load. Carrying the load. When you carry a load, keep the back straight or slightly arched. Walk slowly, keeping the load close to your body. Use your feet to change directions. Avoid twisting the back. Avoid leaning over. And keep the object close to your body and avoid lifting it over your head. Setting the load down. Stand as close as possible to where you want to set the object. Squat down to lower the object using your legs. Do not bend at the waist. Keep your head up and avoid twisting your body while setting the object down. And only release the object when it is located where you want it. To avoid injury, don't release your grip until the object is secured. When lifting or moving some items, it is smarter to use equipment made for such tasks. Forklifts, carts, dollies, hand trucks, wheelbarrows, hoist, chains, and ropes are some of the items which can make lifting and moving items easier. Employees must make sure they are properly trained to use the equipment and are wearing the appropriate personal protective equipment, PPE. When using moving equipment, there are some basic guidelines to remember as applicable. Secure the load with something appropriate, such as lashing straps, tie-downs, or wrap. Use both hands to control the device. It is safer and easier to push than pull. Avoid stairs, inclines, and other uneven surfaces when possible. and using a forklift requires the operator to have specific training and certification. Never operate a forklift unless qualified. Having a safe attitude in your job and during your leisure time helps in an overall back safety program. Additional guidelines to help you keep your back healthy and strong starts with knowing your limits. Never lift objects over your head and never reach overhead to grab something. Use a step stool or platform to move closer to the area to place the object or to reach for an object. Be extra careful as you move onto and off the stool or platform. Many times we reach for an object on an upper shelf without ever thinking that by taking an extra moment to get a step stool, you could save your back from being strained. Never reach over something or somebody to lift an object. Move the item or step around it to get to the object you are lifting. Never jump down from short heights, such as truck beds, loading docks, or from the cab of a pickup. Even though the distance is small, the shock from the impact can injure the discs and other parts of your back. Split larger loads into smaller loads whenever possible. Rushing to pick up something can lead to injury. Take your time and always examine the load. When performing physical labor involving the back, such as raking, shoveling, and digging, make sure you use the proper techniques to keep the back safe. The same steps you learned that apply to correct lifting can be used while performing intensive labor. Preventing back injuries requires not only proper lifting and carrying, but good posture, exercise, and proper diet. The back deteriorates with age, and it is important to do everything possible to keep the back healthy. Remember that good posture is important for a healthy back. When sitting or standing for long periods of time, posture can affect the back either positively or negatively. It is important to learn the correct way to sit, stand, and how to support the back. If you stand for long periods of time, shift your weight from one foot to the other at various intervals. Also, you can stand on floor mats or raise one foot on a stool or step and wear appropriate and comfortable shoes. Always stand or sit up straight. Don't slouch. Place a pillow behind your lower back for additional support. Keep your knees at a 90-degree angle and feet flat on the floor. Exercise while sitting by tightening the stomach and buttock muscles and holding for 5 to 10 seconds. If you sit for extended periods of time, you should get in the habit of occasionally getting up and walking around. Exercising on a daily basis can strengthen the back, stomach, and leg muscles, increase flexibility, and increase the chance of maintaining a healthy back for many years. Make exercise a priority in your life. Just 15 minutes of exercise a day can help prevent injuries and back pain. Walking, running, biking, or swimming are just a few possible types of exercise you can do. Again, wear appropriate shoes when you exercise. There are simple exercises you can perform which help maintain a healthy back. When possible, try to incorporate some of the following into your workday routine, as well as at home. Shoulder shrugs. Stand or sit with arms at sides. Shrug shoulders up toward the ears and hold for 10 seconds, then relax. Hip flexor stretch. Lay on the back with one leg straight and the other bent at the knee. Slowly bring the knee up to the chest and press the back firmly on the floor. Hold for 5 seconds, bring the knee back down, and then switch legs. Repeat 6 times. Partial squat. Stand up straight, bend at the knees, and squat down about halfway to the floor. Hold this position for about 10 seconds. Stand up and then repeat 6 times. Use a chair for balance if necessary. Partial sit-up. Lie on your back with your knees bent and your feet on the floor. Place your arms across your chest and slowly raise head and shoulders off the floor. Hold for 10 seconds and then lower head and shoulders to the floor. Repeat this step 6 times. Proper diet. What you eat can affect the health of your back. Being overweight adds extra stress and strain to the back and body. Maintain the proper weight for your height. Eat appropriate portions. Avoid unhealthy foods, snacks, and drinks. Consult with a medical professional concerning the types and amounts of foods which are right for you and before you start a diet or exercise program. Maintaining a healthy back is an important part of your overall well-being. The #1 cause of lost time and workers' compensation injuries involves the back. It is important that you know how to lift and carry properly. From the moment you know you are going to have to lift and carry an object, you should start thinking how to save your back from unnecessary injury. Do it correctly, and your back will be your friend for a lifetime. Don't become a statistic and wind up on your back.